how to do a sick note. So the official term for sick note is a Med3, and so if you want to do a sick note for a patient, you just do it within the journal tab and you use the code Med3. So you just type that in, hit enter a few times, and then you get this up here. You want to do new sick note. The other option is issued by hand, so that's if you've had it. We don't really do that any longer. So you select new, and then you can select your dates here. So you can backdate it if you like. So you go 10th of February and then until, so you can just choose a date here if you want. Or you can just use 4, so you can put, I don't know, if you put 2W, that's just 2 weeks, and hit enter, it'll automatically do you the date there, or 1 month, or whatever you want there. What you put here doesn't actually matter. This is just a code to make the computer happy. So let's say it's, and that won't be displayed on the sick line, so that one doesn't actually matter. But what you put here automatically comes up here, which you can edit. So this is the bit that displays on the sick line for the employer and the patient. So this one doesn't really matter, but it has to be populated. This one does matter, and you can free text this. So if you're clever and you choose the code correctly, so like chest infection or whatever, and it is a chest infection, then that's fine, you can just leave that. Whereas if the code's not quite right, then you can put, you can alter it. You put viral chest infection or whatever, or you can change it to pneumonia. That's all you really need. And then when you want to print it, you just simply uncheck save to file, and then you click print form, and that will take ages, but it will then print. I don't actually know what this bit, I have no idea what that is, don't use that. And then you just simply click OK, and that then appears in the patient's notes like that. If you want to reprint it, you just click edit, and you can just then print form again if they've lost it, or reception's lost it, or if it's just gone missing, as they almost invariably do. If you want to do a phased return, in fact, no, let's not talk about that. Yeah, in terms of what you do with sick notes, I mean, backdating it is fine as long as it's not too far back. A week or two might be fine. More than a couple of weeks, they would need really special circumstances for you to do that, because they won't, unless they've been regularly presenting, you can't say that they have been unwell a few weeks ago. So maybe don't backdate it too much, but use your judgment. And then in terms of forward, how long the patient needs, well, that's again just your own judgment in discussion with the patient. This is if just to sign them off work. If you want to do phased return or anything like that, you simply uncheck that. This is unusual. Most patients get signed off rather than phased return, but if they do sometimes ask for this, so you can uncheck that box, and then you can choose phased return, alternate hours, or whatever. The only difference there is that you then actually have to put in some remarks. So, half hours for 2 weeks or whatever there, and then that will appear on their form. And I think that's it.